Namaste बिटिया, हमेशा खुश रहो बिटिया. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about another important topic of the respiratory system, that is cystic fibrosis. What is cystic fibrosis? What is the etiopathogenesis? What are the various clinical features, investigation, and management we are going to discuss now. So let's start with the topic cystic fibrosis. Cystic fibrosis, it is a monogenic disorder. It is an autosomal recessive extracraniopathy that is affecting multiple epithelial tissues at a time. So it is basically a monogenic disorder in which there is autosomal recessive exocrinopathies that is affecting multiple epithelial tissues. It results from the mutation affecting the gene on the long arm of chromosome 7. So on the long arm of chromosome 7, there is mutation of the gene. The gene product responsible for cystic fibrosis is the cystic fibrosis transmembrane conductance regulator. It influences the salt and water movement across the epithelial cell membrane. The incidence is 1 in 2500 live births. So cystic fibrosis is due to the mutation in the gene on the chromosome 7. The gene is known as CFTR. Now, what is cystic fibrosis? It is characterized by chronic bacterial infection of the airways leading to bronchiectasis. So there is chronic infection of the airways that is leading to bronchiectasis. Bronchiectasis we have just learned in the last class. That is a permanent dilatation of the alveoli. There is also exocrine pancreatic insufficiency, intestinal dysfunctions, abnormal sweat gland functions, and urogenital dysfunctions. So it is characterized by chronic bacterial infections of the airway leading to bronchiectasis, exocrine pancreatic insufficiencies, intestinal dysfunctions, abnormal sweat gland function, and urogenital dysfunction. In the pathophysiology, the main factor that is responsible for cystic fibrosis, it is the genetic defect that causes increased sodium and chloride content in the sweat, and also increases resorption of the sodium and water from the respiratory epithelium. So it is a genetic defect that causes increased sodium and chloride content and increased resorption of the sodium and water from the respiratory epithelium. There is relative dehydration of the airway epithelium that predisposes to chronic bacterial infection and ciliary dysfunction, leading to bronchiectasis. The gene defect also causes disorders in the gut epithelium, pancreas, liver, and reproductive system. So there is a genetic defect. It causes increased sodium and chloride content on the sweat and increased resorption of the sodium and water from the respiratory epithelium. There is relative dehydration of the airway epithelium that predisposes to chronic bacterial infection and ciliary dysfunction, leading to bronchiectasis. The gene defect also causes disorders in the gut epithelium, the pancreas, liver, and the reproductive tract. Cystic fibrosis produces organ-specific effects on electrolyte and water transport. So it is producing specific effect on the electrolyte and water transport. In the GIT, the defect is in sodium absorption and chloride secretion. So defect in the sodium absorption and chloride secretion causes dehydration of the sodium epithelium, of the surface epithelium, and it causes dehydration of intramural contents and intestinal obstruction. So it is causing dehydration of the intramural contents and intestinal obstruction. In hepatobiliary system, there is defective chloride and water secretion that causes thickened biliary secretions, focal biliary cirrhosis, and bile duct perforation. Inability of the cystic fibrosis, the gallbladder epithelium, to secrete salt and water can lead to both cholecystitis and cholelithiasis. So because of this particular disorder, there is defect in the JAYOTI, there is defect in the sodium absorption and chloride secretion that causes dehydration of the surface epithelium. It causes dehydration of the intramural contents and intestinal obstruction. In hepatobiliary system, there is defective chloride and water secretion that causes thickened biliary secretions, focal biliary cirrhosis, and bile duct perforation. There is inability of the cystic fibrosis bladder epithelium to secrete salt and water that can lead to both cholecystitis and cholelithiasis. In the sweat gland, the sweat secretion is normal but is not able to absorb sodium chloride from the sweat duct. Now we come to the clinical features. In the clinical features, the lungs are usually normal at birth, but there is bronchial inflammation and infection that usually leads to bronchiectasis in the childhood. Common infections include Staphylococcus aureus, Pseudomonas aeruginosa, recurrent exacerbation of bronchiectasis, recurrent exacerbation of bronchiectasis causes progressive lung damage, resulting ultimately in the death from the respiratory failure. There is upper respiratory tract disease that is causing chronic sinusitis and incidence of nasal polyp. In the lower respiratory tract, cough which becomes persistent. There is persistence of the cough and produces viscous, purulent, and often greenish sputum. So there is production of viscous, purulent, and greenish sputum. There are periods of clinical stability interrupted by pulmonary exacerbations and often triggered by viral infections. The symptoms include increased cough, weight loss, low-grade fever, increased sputum volume, and decreased pulmonary function. Over the course of time, the exacerbation frequency increases and recovery is lost and the lung function becomes incomplete, leading to respiratory failure. So in the lower respiratory tract, we have cough which becomes persistent. It produces viscous, purulent, and often greenish sputum. The periods of clinical stability interrupted by pulmonary exacerbations is often triggered by viral infections. There are symptoms which includes increased cough, weight loss, low-grade fever, increased sputum volume, and decreased pulmonary function. Over the course of time, the exacerbation frequent increase, the recovery is lost, and the lung function becomes incomplete, leading to respiratory failure. In the complications, the complication will lead to bronchiectasis, that is the permanent dilatation of the bronchi, pneumothorax, hemoptysis, nasal polypus, respiratory failure, and core pulmonary. So, in the complication, we will have bronchiectasis, we will have pneumothorax, hemoptysis, nasal polypus, respiratory failure, and core pulmonary. The gastrointestinal complication consists of meconium ileus, malabsorption, and steatorrhea. There is distal intestinal obstruction syndrome that is known as DIOS, biliary cirrhosis, and portal hypertension with gallstone. There is exocrine pancreatic insufficiency that occurs in 90% of the patients with cystic fibrosis. Insufficiency leads to deficient pancreatic enzyme secretion, hence protein and fat malabsorption. There is malabsorption of fat-soluble vitamins in pancreas that can involve beta cells, leading to diabetes mellitus. Genitourinary complication includes azoospermia in males due to obliteration of the vas deferens due to defective liquid secretion. 20% of the women are infertile. Another can have diabetes, delayed puberty, male infertility, stress incontinence, psychosocial problems, osteoporosis, and arthropathy. Diagnosis. How to diagnose a case of cystic fibrosis? The diagnosis is made from the clinical picture. With bowel obstruction, failure of an individual to thrive, that is increasing weight, steatorrhea, that is fat and stool, chest symptoms in the young child. Diagnosis is supported by sweat electrolyte testing, genotyping, that is DNA analysis, decreased lung function test, that is FVC and FEV1, X-ray hyperinflation of the lungs. How to manage the particular case? Management is done by doing two things. We have to manage the respiratory complaints, and the second management consists of non-respiratory complaints. So number one, we have respiratory complaints, and number two, we have non-respiratory complaints. In the management of respiratory complaints, the main objective of the therapy is to promote clearance of secretion and control lung infection. So the main objective is to promote the clearance of the secretion. The secretion have to be cleared and control the lung infection. Pulmonary secretion clearing techniques, which includes exercise, chest percussion, etc. 95% of the death occurs due to complications of the lung infection. Staphylococcus aureus infection, which includes oral antibiotics, intravenous treatment, etc. Pseudomonas infection is treated by nebulizing antibiotic therapy. Inhaled beta antagonists are given to control the airway contraction, and regular chest physiotherapy can be done. So the management, the main objective is to clear the secretions of the lung and control the lung infection. Pulmonary secretion clearing techniques are performed with exercise, chest percussion, etc. 95% of the death occurs due to complications of the lung infection. Staphylococcus aureus infection, oral antibiotics, intravenous treatment is given. Pseudomonas infection is treated by nebulizing antibiotic therapy. Inhaled beta antagonist to control airway contraction, and regular chest physiotherapy. Now, how to manage the non-respiratory complaints? Non-respiratory complaints related to the other organ are managed by oral pancreatic enzyme supplement. We have to give the supplement the oral pancreatic enzymes. Vitamin E and vitamin K has to be supplied. Insulin for diabetes should be given. Gene therapy, that is done by manufactured normal cystic fibrotic gene that can be packed within a viral or liposomal factor and delivered to the respiratory epithelium to correct the genetic effect. And management of the psychosocial problems like counseling for health insurance, career options, and family planning, etc. need to be done. Because of the lung fibrosis, the patient may not be able to speak much. So we have to check for the counseling for the health insurance, career options, and family planning. What is the homeopathic management? There are various homeopathic medicines which can be given in such cases. Homeopathic medicines include sulfur, arsenic album, arsenic iodatum, tuberculinum, phosphorus, iodine, silicea, sanguinaria, calcarea carb, lycopodium, trinia, calcarea phos, ammoniuriaticum, calcarea iode, sepia, nitric acid, and phylendrium. Now I'm giving you indication of few of the homeopathic medicines. Number one, arsenic album. Cough is worse after midnight, worse lying on the back. There is expectoration is scanty and frothy with darting pain through the upper third of the right lung. Wheezing respiration, hemoptysis with pain between the shoulders, and burning head, heat all over. RSIO, there is afternoon rise in the temperature that is indicated by profound prostration, rapid irritable pulse, recurring fevers and sweats, emaciation, tendency to diarrhea. Balsamum peruvianum, it is useful in debility, active fever. Phthisis with mucopurulent, thick, creamy expectoration, loud rales in the chest, very loose cough with active fever, night sweat with irritating short cough and scanty expectoration. We can also give calcarea iode in the treatment of scrophulous affection, especially enlarged tonsils, etc. chronic cough, pain in the chest, difficulty breathing after syphilis, active fever, pain purulent expectorations. Iodine is given with great debility. The slightest effort induces perspiration, great weakness about the chest, and palpitation from least exertion. There is pleuritic effusions tickling all over the chest. Iodine cough is worse indoors, in warmth, wet weather, and when lying on the back. Cali self, with coarse wails, rattling of mucus in the chest. Cough is worse in the evening in hot atmosphere. There is croupy hoarseness, cough with yellow expectoration, rise in temperature at night, and intermittent fever. Next, we have Philodendron aquaticum. It is a very good remedy for offensive expectoration and cough enthysis. Everything tastes sweet, dyspnea, and continuous cough. Early in the morning, cough with profuse and treated expectoration, which compels the patient to sit up. Phosphorus, the whole body trembles with cough, sputa rusty, blood colored, and purulent. Sulfur is given in the oppression and burning sensation in the chest. With difficult respiration, once the windows open, loose cough, worse talking, morning, greenish, purulent, sweetish expectoration, with much rattling of the mucus. Tuberculinum is given of undoubted value in the treatment of incipient tuberculosis, especially adapted to the light complexion and narrow-chested subjects. So this was all about cystic fibrosis. In the next lecture, we are going to discuss about COPD. So this was all for today. This session is powered by digital version 2.0, JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box and I'll try to resolve. So this was all for today. Thank you very much. Have a good day.